Hello, this is Dr. Deepthi Nandan Reddy. I am a shoulder and hand surgeon at Yashoda Hospital, Hitec City. We'll talk about nerve compressions in the wrist and the elbow today. Nerve compressions in the wrist, commonly known as carpal tunnel syndrome, is a very common problem which we hear about and talk about, and it's often associated with people working for long durations on computers, keypads. And you know that there have been a lot of modifications in the computer keypads so that we get better ergonomics and reduction in pressure on the carpal tunnel. And this prevents carpal tunnel syndrome is what we are told in the media and everywhere else. But the fact is that majority of the time carpal tunnel syndrome is not only seen in computer professionals but also in people who are doing normal day-to-day work. Most of the people I see in the clinic, in my hand clinic, is people who have been doing household work, who have been having tingling and numbness in their fingers and thumb. So what is carpal tunnel syndrome? Carpal tunnel syndrome is nothing but compression of a nerve called the median nerve in the carpal tunnel at the wrist. So why does it happen? Because the space for the nerve is reduced in the tunnel. What is a tunnel? Because this nerve is sharing its space with 9 other tendons. So when there is inflammation or a lot of swelling around the tendons, there is pressure on the nerve. When there is pressure on the nerve does not function properly. That is why you get tingling and numbness. This nerve supplies the thumb, the index finger and the middle finger and part of the ring finger itself. So if there is a compression of this nerve, you get numbness in these, you will get dryness of your fingers at the tip. Typically, you will wake up 2 or 3 in the night when you get a lot of tingling, you wake up and start shaking your hand. So this is the carpal tunnel, this is the hand, the inner aspect of the hand. So you see this yellow structure is the nerve, it supplies the sensation to the thumb, index finger, middle finger and part of the ring finger. So when the blue structures are the tissue which is covering these tendons. So whenever you have arthritis in the thumb here or inflammation in these tendons, the pressure is increased here, so the nerve is compromised. So in a surgery, we release this tunnel, the sheath of the tunnel, so we create more space for the nerve itself. Sometimes this carpal tunnel syndrome can be seen in diabetics, in people who have hypothyroidism, where both the hands can be affected. Now, why is it so important to recognize this early? Because if we don't recognize it early, prolonged duration of compression of the nerve will cause dysfunction of the nerve. That will result in numbness of the fingers permanently. And not only that, one of the main structures which mobilize your thumb, which is called the abductor pollicis brevis muscle, is dysfunctional. That means it becomes smaller and weaker. So we will have difficulty in holding objects, putting your buttons on, doing anything fine, writing, and all these can be difficult, and you'll start dropping things when you're holding your plate and things like that. So if we recognize it early and release the nerve, and that is the treatment for this condition, where we open the tunnel in which the nerve is sitting. So we create more space for the nerve, more breathing space for the nerve, so the blood supply to the nerve is better and the function is restored. If we identify it very late, after the muscle is become very small and the numbness is completely set in, we cannot reverse the condition completely. So we have a window of opportunity where we need to treat this and relieve the pressure on the nerve. So it's recognizing is important, treating it at the right time is important. And how do we diagnose it objectively? We do what's called a nerve conduction study done by the neurologist, and if the nerve is not conducting the electricity which is passed through it on a certain time and duration, then we come to a conclusion that the nerve is not functional. But majority of the time it is the non-functioning nerve recognized through clinical examination. So getting it examined clinically is the most important, and we don't have to rely on a test every time, because sometimes nerve conduction studies may not pick up a carpal tunnel syndrome.